Welcome to our mnemonic video on leg pain differential. Let's get started. This story will take place on a battlefield camp in the hot desert. The camp looks pretty calm so far. Here we see a weary soldier taking advantage of that calmness by napping while propping his sore legs up on his knapsack. Well, this soldier's sore legs should remind you of leg pain, which is what this video is all about. Now, the end of this quietness came very quickly, however, as we hear a loud noise from that military cargo plane landing to deliver supplies. While looking at the cockpit, we see the plane pilot who has been flying it for hours to get to this base camp. Sitting for prolonged periods, such as on a long flight, can predispose to deep venous thrombosis, often referred to as DVTs, which is a serious cause of leg pain that usually presents with a swollen, painful calf on physical exam. A DVT is an emergency because dislodging of the thrombus can result in a life-threatening pulmonary embolism. And in some cases, if the patient has a congenital septal defect in the heart, the embolus can travel from the right side of the heart to the left side, ultimately ending up in the brain, causing a stroke. Now, as the clot forms, the fibrinolytic system is activated, resulting in the production of some byproducts. Most importantly, the D-dimer product, which is a very sensitive test, almost too sensitive, which can actually diagnose a DVT or a pulmonary embolism. And that's depicted here in the shape of this ladder to the side of the plane. So it's shaped like the chemical structure of D-dimer. Remember that this ladder allows that pilot to get out of the plane. And so does the D-dimer. It helps rule out a DVT. Remember I said it was very sensitive. So if the D-dimer is very low, then you can rule out a PE. In the distance, we see a large cross falling over. It seems like those ligament-like ropes were severed, causing the cross to fall forward. Now the word cruciate means cross-shaped, and those cut ropes and the cross falling forward or anteriorly should remind you of an anterior cruciate ligament tear, an ACL tear, and that can be a cause of leg pain, and it's detected by a positive anterior drawer sign. Now, the anterior drawer sign is done by stabilizing the hip at 45 degrees while bending the knee at 90 degrees. Then you pull the leg anteriorly with a rather rapid or explosive movement. You don't want to add injury, but just recognize you're trying to pull it anteriorly. And if the anterior cruciate ligament is intact, then the ligament itself would prevent any excessive anterior displacement of the leg when you perform that exam. Therefore, significant forward displacement is considered a positive anterior drawer test and indicates a anterior cruciate ligament tear. Now let's see who cut the ligament ropes. It's that soldier who's throwing a boomerang to cut the ropes from a distance. Well, the curved shape of this boomerang should remind you of the C-shaped piece of cartilage in between the femur and the tibia, also known as a meniscus. The meniscus boomerang has had some heavy wear and tear, as evidenced by the cracks running through it. Well, this cracked and curved boomerang should remind you of a torn meniscus, another on the differential diagnosis of leg pain. Now, meniscus tears often happen when there's a forceful twisting of the knee, like in that soldier's position. Now, it's worth noting that if we added the medial collateral ligament injury to this scene of a cracked meniscus boomerang and the falling ACL cross, the result is an injury collectively known as the unhappy triad or a blown knee. Now, the unhappy triad happens when the knee sustains a lateral blow while the foot is fixed to the ground and is another potential cause of leg pain. Now, don't look now, but here comes a gnarly-looking battlefield injury. Lying on the ground in front of that tent is a soldier with a severed knee and ankle, and he's crying out in pain. This unfortunate soldier should remind you of the traumatic causes of leg pain, including knee and ankle fractures. Now, these types of injuries are often more subtle than you would see in our wounded soldier. You don't need to be a doctor to recognize why that guy's in pain. In fact, knee and ankle fractures can sometimes be missed on physical exam and even radiographs. So always consider injuries or fractures in the setting of leg pain. Now, coming to this soldier's aid is an Army medical vehicle. And notice the shape of the two antennae on the vehicle. The prongs of the front antenna, which looks kind of like the legs, are bowed inwards. And the inward bowing of the legs is called a valgus deformity, also known as a knock-knee deformity. Now, a valgus deformity results from an abnormal medial collateral ligament, or MCL, and that will present with a positive valgus stress test, which is a physical maneuver where the leg is extended and raised 30 degrees off of the surface, then pressure is applied to the lateral side of the joint. If there is excessive laxity of the MCL, then the knee joint will bow inward significantly. Unlike the antenna in the front, we see the prongs of the back antenna are curved outwards. That should remind you of a varus deformity. And this time, it's the lateral collateral ligaments, or LCL, that's excessively lax. And that causes the legs to bow outward, which is the opposite of the valgus deformity. Now, both conditions can be congenital or due to lower extremity trauma. And you should keep these ligaments and damage to them on the differential diagnosis of your patient with leg pain. Now, this Army med vehicle not only is stopping to help our soldier with the severed knee and ankle, but it's also heading to aid this wounded soldier across the battlefield who took a shot to the knee. He must be in a lot of pain. Just look at that red, inflamed, and wounded knee exposed to that dirt of the desert. This idea should make you think of septic arthritis, another differential diagnosis of lower leg pain. Now, septic arthritis presents with fever, as well as knee pain, redness, warmth, and a restricted range of motion. And treatment involves antibiotics and draining of the affected joint. Now, while this soldier is kneeling in pain, we can see his unique combat boots and knee pads, which look large, red, and swollen, with many red spikes, much like what you'd see in gouty arthritis, another potential cause of leg pain. Elevated serum uric acid causes deposition of urate crystals in the joints, which precipitates that gout attack, that painful arthritis. And many medications, pathologies, and types of food even can increase the level of uric acid. So how do you manage these? Now, acute attacks are usually treated with NSAIDs and colchicine, while prophylaxis against recurrent gouty arthritis includes the use of urate-lowering therapy. For example, xanthine oxidase inhibitors or uricosuric agents. And besides those prophylactic medications, patients can also make lifestyle changes, such as decreasing the amount of meat or alcohol in their diet. Now, these spiky red caps over the knees and toes should remind you that gout pain classically localizes to the knee or big toe. Now let's take a closer look at what he dropped on the ground when he sustained that bullet injury. It looks like a Rubik's Cube. Back when the base camp was uneventful, this soldier would often pass the time working on his Rubik's Cube. Notice that this cube is unique, and the small squares making up the 6 sides are shaped like small shields, giving the appearance of a shield wall. Well, it must be a special Viking edition of a Rubik's Cube. Now, this soldier is a fan of Vikings, which is why he has this special edition cube that mimics the shield wall maneuver that was so popular with Viking warriors. Well, the shield wall is when warriors arrange their shields next to each other to create a wall that surrounds and protects them from their enemies. And this idea of a shield wall enclosing its soldiers inside should remind you of a granuloma, which is a walled-off area of inflammation. A granuloma is the body's response to protecting itself against the spreading of infection. And many diseases can cause the formation of granulomas. But one granuloma that is worth mentioning here is sarcoidosis, which is a systemic disease that can involve the joints and bones, leading to painful arthritis. Therefore, granulomas, like in sarcoidosis, can be another cause of leg pain. Although this soldier is wounded, as a Viking fan, he won't give up that easy, and he's looking up to find an alternative way to continue fighting. And in his right hand, he's holding an oil can. And now we see why. A giant war machine is stationed at his side. He knows he will first need to oil up this war machine before riding it to fight back. And notice that the joints of this machine have rusted in the humidity of the desert. I guess this desert's particularly humid. And these rusted joints should make you think of inflamed joints, or osteoarthritis, which results from the breakdown of the joint cartilage, and ultimately the underlying bones. Osteoarthritis is the most common form of arthritis, therefore, you gotta keep this on your differential for leg pain. Now, other symptoms include joint swelling, stiffness, and decreased range of motion. Treatment involves reducing the mechanical stress on the joints by reduction of weight, as well as using pain medications, joint injections of steroids, like what our soldier here is about to do, and you can even perform surgery in especially debilitating cases. Now, technology development has provided this battlefield with more than this war machine, however. Here we see a Roomba robot. Their latest model is a landmine detector, if you didn't know. So this particular Roomba will sweep the desert for any potential danger and make a safe path for that rusty robot. And the design of this Roomba robot edition is to self-destruct once it sweeps over any landmine as a way to help contain an explosion. Well, Roomba sounds like rheumatoid, as in rheumatoid arthritis. And the fact that it's self-destructing should remind you of an autoimmune process, where antibodies attack self-antigens and the body harms itself. Rheumatoid arthritis is associated with the HLA-DR4 gene, depicted by that label on this rheumatoid Roomba. So this disease is another differential diagnosis of leg pain, and it results in chronic, progressive joint degeneration, and you manage it with immunomodulatory therapy. Now let's take a look at our last soldier. He's lying on the ground firing away a large machine gun. As the soldier fires the gun continuously, it goes up in flames, and the flamed bullet cases discharging from the gun burnt his leg. And to keep shooting, he decided to bend his knee backward. Well, flames are our symbol for inflammation, and the soldier's burning leg should make you think of skin inflammation, like cellulitis and erysipelas. Both are causes of leg pain. Both cellulitis and erysipelas are bacterial infections. However, cellulitis extends into the deep dermis and presents with a rash with poorly defined borders, whereas erysipelas is confined to the superficial layer of the dermis, and it presents with a rash with well-defined borders. Now, untreated skin infections can lead to an abscess formation, represented by this pile of flaming bullet shells here, which looks like an abscess, and it's typically treated using antibiotics and proper drainage. And this surprising battle came at the expense of this soldier's lunch. He planned to eat a delicious apple pie before the surprise enemy fire, but since he had to fire back for a long time, the flame from the gun and bullet cases has also managed to burn his pie aside of his leg. Well, the pie sounds like pyogenes, as in Streptococcus pyogenes. And the fact that it's burnt or blackened should make you think of necrosis, more specifically necrotizing fasciitis, which is a life-threatening cause of leg pain. Necrotizing fasciitis is most often caused by strep pyogenes, and it can quickly progress to sepsis, shock, and even death if not recognized and treated promptly. And with that, you have all you need to know about the differentials of leg pain. See you at the next battle.